And we're back. Of course, there's a lot of focus on health these days. We're at the peak of flu and cold season. We are talking about COVID-19, of course. But our next guest is also a man that can make changes in lives and changes in relationship, and it deals with a health situation that many people don't want to talk about. Let's go ahead, bring in Andrew. We are talking about ED today. Once again, the conversation people don't want to have, but it really does affect all of those aspects of life. And the key is you can help, right?
Yes, we absolutely can. South Bay Medical Clinic treats erectile dysfunction, like you said, but we do it in a very different way. We're taking all of the negatives out of treating ED. Our treatment is called acoustic wave therapy. Now, it's clinically shown to open up and regrow blood vessels. Erectile dysfunction, at the end of the day, it's a blood flow problem. That's what we're treating. And the pills that guys have taken for so long, they're just relieving symptoms, best case. They come with a lot of nasty side effects. And now we're going around that, treating the root cause problem of erectile dysfunction. You don't have to take a pill any longer. And here's the key word of the day: spontaneity, back into the relationship like it was in a man's younger years.
You know, I'm glad that you're talking about affecting the root cause, because I feel like so many medical treatments that are out there for any kind of ailment people are talking about, it's basically just putting a bandage on it. But this process that you're able to do, which I want you to explain the process, again, gets to the problem to be able to give your word of the day, spontaneity, right?
That's exactly right. So erectile dysfunction is caused by damaged, aging, or blocked blood vessels. The blood flow simply cannot get through. So our treatments open them up with gentle pressure waves. A treatment is about 10 minutes. It's not invasive. It's just done right on top of the skin. And a guy would come in for a few of these treatments over about 2 weeks. That is it. And you said it, the root cause of the problem, so that when the timing is right in the bedroom, the blood flows properly. We're not just putting a Band-Aid on the problem. Every man can remember back to his younger years when he didn't have to stress about those intimate moments. He didn't have to take a pill. Things worked like they should. As far as I know, our treatments are the only thing that can restore that.
It's interesting you talk about not wanting men to stress about this. We have enough stress going on, right, Andrew? We don't need to throw this in there too, and you're offering ways to help. But I think one of the biggest key components that we need to discuss, though, how it works as far as clinical studies, the safety elements, because of course that's going to be in the back of everybody's mind if they come and see you.
Oh, absolutely. Now, the science page at southbaymedicalclinic.com has a lot of good reading material on this. In fact, there's over 40 clinical studies now posted from places like Cambridge. Cambridge said safe, effective. They said at the end of their testing, all men experienced an increase in blood flow. The American Urological Association, same thing. They called this revolutionary for erectile dysfunction. So I think it is safe to say now this is clinically proven to work, regrow blood vessels, and it's safe. There's no side effects. A 10-minute treatment, that's pretty easy. No pain, non-invasive, and no recovery time.
Okay, we've got about a minute left, Andrew. Can you share with us some of the feedback that you do get to hear day in and day out when it comes to helping men?
Oh, yeah. One comes to mind, 77-year-old gentleman who was taking pills and injections for his erectile dysfunction. He eliminated both of those 1 week into his treatments. He said he was performing in the bedroom like in his 40s. So we love to hear that.
Let alone the fact I'm clearly not a man, but the thought of injection, not something that people want to think about either. So I like when you share that story. But in closing, I know there's a special offer right now that you want to share with people because you believe so much in this treatment and want to help.
Absolutely. If you or your man are struggling with erectile dysfunction, if you're sick of the pills, get your phone ready. We're going to give away a lot for free today. Call us now. We'll do the assessment, the exam, blood flow ultrasound even, totally free. We'll also throw in a little special gift that I don't think I've ever seen this fail. It produces instant results in the bedroom. It's a $500 value, free to everybody that calls right now.
Good stuff, Andrew. Thanks for your time, buddy.
Thank you.